right, guys, we are almost to the end. Oh my gosh. So the last class we're going to talk about is our proton pump inhibitors. Right. So how does this medication work? It suppresses gastric secretion. It is used to treat active ulcer disease, erosive esophagitis, and pathological hypersecretory conditions. Drug name, these are your Zoles. All right, the NNAZOLES. So who should take this medication? So we already talked about the first 5 of these, but the last one I want to bring into your knowledge is the treatment of H. pylori. Who shouldn't take this medication? Only thing I could find was those who have known allergies of this medication. They shouldn't take it. So some side effects of your PPIs are headaches, diarrhea, abdominal pain, and nausea. They are at an increased risk for C. diff. So what is C. diff? C. diff happens when there is a disruption of normal healthy bacteria in the colon. So a bacteria then starts to form in the colon. And this patient will have diarrhea, and it is a very distinctive smell. If you ever smell C. diff before, you're going to know when it's C. diff. So they're at risk for C. diff because this medication inhibits gastric acid productions, leading to the proliferation of spores. So remember that your stomach needs to have some gastric acid in there to do what it needs to do. But when you don't have that gastric acid, guess what? Your body can start building up types of bacteria. There are increased risk for osteoporosis related fractures. It says it can alter your intestinal calcium absorption, resulting in an increased rate of bone loss. So remember, calcium, bones, bone loss, fractures. How to administer this medication? You want to take it on an empty stomach. It's normally given early in the morning, even before breakfast. So you want to administer PPIs about 1 hour before or 2 hours after administering other oral medications as prescribed. You want to make sure that they swallow this medication whole. Nursing considerations, you want to monitor your liver function tests. We want to monitor our calcium levels. And we also want to be very cautious of the patient's safety, because it can lead to potential fractures. Fractures lead to what? Falls. So safety. It's a little far-fetched, but hey, you never know. This patient could be on this medication long term and then haven't had their calcium level checked in forever and then realize their calcium is so low. All right, NCLEX question. A client has been taking omeprazole for 4 weeks. The nurse determines that the patient is receiving the optimal intended effect of the medication if the client reports absence of which of the following symptoms? A. Diarrhea. B. Heartburn. C. Flatulence, which is gas. Or D. Constipation. The answer is